I'm Dr. Shannon Ferguson, and this is Move It or Lose It, and today we're going to be talking about tennis elbow and golfer's elbow. Tennis elbow and golfer's elbow are very similar conditions. They're just on opposite sides of the forearm. There are overuse injuries of the tendons that control flexion of the wrist or extension of the wrist. So it feels like it's on the elbow, but it's the muscles that actually cross all the way on the wrist. What's happening on a tissue level is the musculotendinous junction, so the point where the muscle and the tendon meet, starts to become frayed. So it's this microscopic tissue damage that keeps breaking and repairing and breaking and repairing and getting worse over time. It's not something that you can see on ultrasound. It's usually diagnosed by exclusion, making sure that it's not anything else, but also a physical exam and testing the motion of the wrist and elbow. With any well-rounded treatment plan, it's important that you are addressing multiple different pathways of why the pain might be happening. So stretching, exercising, so strengthening both the hand and the forearm and the rest of the arm ideally. Addressing the fascia, so fascia massage, self-massage, foam rolling, physio, acupuncture. Another thing that might be a good idea is using magnesium sprays. I find these really, really helpful for acute pain, or magnesium lotions, and that just helps calm the muscles down and calm some of that inflammation down. Successfully treating tennis or golfer's elbow has to be a multi-pronged treatment approach, just like anything that you're treating. So it works best if you are stretching, exercising, addressing the way that you're moving. So whatever motion that you are doing over and over again, if you can, either taking a break from that activity or finding a different way to do it so that you are using multiple different muscles, not just the muscles of the elbow and wrist.
So to begin, we are going to stretch the forearm. So this is an extensor stretch. So you make a fist and then bring the fist in towards your chest while keeping your elbow straight. So you should feel the stretch mostly where, if you have tennis elbow, where you feel the most amount of pain by your elbow, but also throughout that whole forearm and maybe even into the wrist. If you feel pain, make sure to back off just a little bit. I have pretty large range of motion in my wrist, so you might not end up getting this far, but go to where you feel a point of pleasant stretch. And now we're going to do the other side. So same thing, straight elbow, and then bring the fingers up and then in towards your chest while keeping your elbow straight. So you should feel this if you have golfer's elbow, right where you feel the most pain, but all throughout that flexor side of the forearm and then maybe even into the wrist. We're holding all of our stretches for about 45 seconds, I believe, but anywhere between 30 seconds and a minute and a half is great. And now we're going to be doing the biceps and a little bit into the pecs and chest. So we're also wanting to stretch all the things that connect into the elbow on the other side. So this is the biceps and the triceps, because if there is any connective tissue or scar tissue translating into this area, we want to loosen it up as well. So clasp your hands behind your back and then lift up as far as you can. So this should not cause any pain in your shoulders. If it does, back off and reach more toward the floor instead of going up. And you should feel most of this stretch in your biceps, so the front of the arm above the elbow. And now we're going to do the triceps. So this is the part of the arm that connects into the golfer's elbow area of pain, but just a little bit above. So I am grabbing my elbow behind my head and gently pulling it back. You'll feel this stretch in the back of the arm, so the triceps, but also into the rotator cuff a little bit and into the lats. Especially if you lean over to the side, you'll feel this stretch into the side body. So the lat muscle. If you don't feel a stretch, maybe wiggle around the angle of your arm until you do. And shoulder mobility does play into this a bit. So if you feel pain, back off and wiggle around until you don't feel any shoulder pain. And now we're going to be doing grip strength. So I've got a little squishy pillow thing, and I am squishing it in rhythmically. So I'm holding it and then letting go, and holding it and letting go. I find grip strength is really helpful in tennis elbow and golfer's elbow. So another way you can do this is if you're doing heavy weights with your legs, you're working grip strength with your hands. Or if you're a wall climber, you're really working on grip strength with that as well. So now we're doing forearm strength. So this is supinator and pronator muscles. So these are often involved in tennis elbow and golfer's elbow, and sometimes issues with these muscles can masquerade as tennis elbow or golfer's elbow. So I've just got a 2-pound weight and I'm doing little figure eights. And then I tried to reverse it, and I think I did. So go both ways with the elbow at a 90-degree angle. Oh, there, I reversed it. Okay, so that's reversed. So go one way, and then after a couple of reps, go the other way. So now we're going to be working out the flexors and the extensors themselves. So I've grasped the 2-pound weight with a bent elbow, and I'm holding that elbow in place while I am lifting the wrist and the back of the hand up toward the chest. So this is the muscle that's involved in tennis elbow. So we're just strengthening it gently. And now this is the other side. So this is the flexors. So same thing, elbow bent at an angle and keeping that steady. And then do enough reps to where you don't feel pain, but you do feel a little bit fatigued. So probably somewhere between 10 and 15 for each side. And now I'm doing some self-massage. So loosening up this tissue is really important, and it helps with blood flow as well. So I've got the base of the pad of my thumb, and I'm pressing that up toward the elbow while I am stretching the muscle. So I grasp onto the muscle, move up while going into a stretch. And the same thing with the other side. So I go up toward the elbow, which is a little bit tricky with angle-wise for golfer's elbow, but going up and toward the elbow with the bottom of the pad of the thumb. And lastly, we are doing a foam rolling stretch. So I've got my foam roller and my wiener dog, and I'm putting that muscle into a stretch while rolling on the foam roller. So foam rollers are really great at connective tissue stretch. And if I'm stretching the muscle while I'm pushing into that fascial stretch, I get a little bit of extra work in there, and it feels really, really good. So same thing with the flexors. So I'm bringing the fingers up toward my chest while pressing into the foam roller. And you can control how much it hurts by pressing more or less into that foam roller.
Thank you for watching my video on tennis elbow and golfer's elbow. I hope that you enjoyed it. If you like this video, please subscribe to get more updates on stretching and pain-free living.